You know, it's one thing for a celebrity to get a nip here or a tuck there, but how about when ordinary folks spend thousands of dollars? In one case, a man in Los Angeles spending $80,000 to look like a celebrity. In this case, Britney Spears. Is it a good thing or a bad thing if somebody comes in to your office, I'm going to start with you, Sean, and says, I want to look like this movie star?
I think that it's pause for concern when a 31-year-old gentleman comes in with pictures of Britney Spears and wants to look like her. I think that it's nice to have a picture for a frame of reference, but I think there's a lot more going on than just plastic surgery with this patient, and talking about mental health and body dysmorphic disorder to make sure everything's on the up and up would be my first thing to talk to him about.
Mark, how about if it's the same gender? How about if a woman comes in saying, I really want to look like Meryl Streep?
Well, that certainly takes one thing off the table, because I'm concerned that this patient may have gender identity issues, and certainly you wouldn't do a gender male to female, female to male without full psychological evaluation. So if it's same-sex person, you don't have to worry about that. But still, it's about setting expectations in plastic surgery, and maybe there's some surgeons that have skills I'm not aware of, but I cannot turn one person into another. It's even very hard to give one person another person's nose. I look at photos to get an idea what's in a patient's head and what features they like.
Craig, big red flag?
I think it is a red flag, and with the gender issue off the table, I like them when they bring in pictures. I encourage people to bring pictures of what they like and actually what they don't like. As far as matching someone, I agree with Mark. I think that I would never go that route.
Patient expectations, if they come in wanting to look like this celebrity, is it tough to match them?
Absolutely, because just as we were saying, we have skills to manipulate tissue, but we can't create new tissue. And I think expectations for everyone is important, but specifically when someone has a specific goal to attain, we really need to kind of bring it to their right level.
When a person comes in and wants to look like someone else or a celebrity, I have to think about, is it just the features they want, or do they really want to look like that celebrity?
Is it hard to say, no, I can't do that?
I don't think it's hard to say no. And I think if the expectations are like that to match someone, I think saying no is probably the correct thing to do.
I think that as doctors, we always want to please our patients and we want to do right by them.
Yeah.
But I think sometimes doing right by them is telling them that no, we can't do that. You're born with a jawline. We can finesse it and we can make it a little bit more sharp, but you're not going to create a Brad Pitt jawline if you don't already have that started with.
I thought I was going to become the next George Clooney. Yeah. Thanks, guys. If you'd like any more information, go to theplasticsurgerychannel.com.